Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area COVID Task Force. Thank you for joining us today. When I left you last week, I had mentioned we need to be responsible in two ways, and one was for our Labor Day Drive Sober Get Pulled Over campaign we were doing, and I'm happy to report that over the Labor Day long weekend, we only had one DUI and no alcohol-related crashes, so that's awesome. So thank you for everyone for being responsible out there and doing the right thing. Continue to do that as we move forward. Get a cab, get a lift, whatever that is, plan ahead. And then the other thing too is be responsible in the second way and do your due diligence and help slow the spread of COVID. And with that, I will turn it over to our first speaker today, and that is Mayor Caron with a community update. Thank you.
Good afternoon. Today is Thursday, September 10th, 2020. In South Dakota, in Coddington County, we have 516 cases so far. 330 have recovered, and that leaves 184 active. 2 people have passed away from COVID. We've had 177 people in our state pass away from COVID so far. And currently, throughout our state, 83 people are hospitalized. Within Prairie Lake's healthcare system, we have 5 in the hospital at this time. We have been seeing our numbers go up, and more than half of the states across the country have a mask mandate. We saw recently a neighboring town put a mask mandate into effect, and I've been asked over and over again, at what point will there be a mask mandate in Watertown? And the way that I would answer that is, I hope we don't have to mandate masks. I don't think that we need to. Masks help us to keep our employees healthy, and that helps to keep our businesses' doors open. And everybody wants that. So I think if we would all look to wearing masks as being a route to keeping people healthy and not allowing everyone to get sick at the same time, which would cause our businesses to have to close their doors, we'll be just fine. So please continue to make responsible choices. And I'd like to introduce the Chief Medical Officer for Brown Clnic, Dr. Dan Rieffenberger.
Okay, I am going to go through a few points here again today, and I wrote them down again to try to stay on task. Otherwise, I could be up here for a while talking. So I'm going to read through my notes. A lot of things have been going on here lately as far as the numbers going up. We get phone calls every day. We get to the point where we're sounding like a broken record, repeating the same thing all the time. So I'm going to outline some of those things of criteria here first. So if you test positive, you are to self-isolate for at least 10 days after your symptoms started. And this must then include having 3 consecutive days where you're not having any fever or symptoms without taking any fever-reducing medications. The Department of Health will be in contact with you as well. There is no need to keep retesting for COVID at the end of this time or weekly, as we'll have some patients coming in requesting, as these individuals can remain positive for months. And so they are no longer considered contagious after that initial time period. What should you do if you come in close contact, which is defined by something less than 6 feet or for 15 minutes or greater time duration with someone who has tested positive for COVID? Okay, that individual should self-quarantine and self-monitor their symptoms for up to the next 2 weeks. Okay, what if the one who is being tested has no results yet? Whether or not they do or don't have anything of any symptoms, okay, they should self-monitor and practice social distancing. What if that individual has come in close contact with someone who might have been exposed? Okay, practice social distancing. We have that all the time. Well, I was with so-and-so who was by so-and-so by so-and-so. Okay, if you weren't in direct contact with that individual, relax. Just keep the social distancing going. In general, it is encouraged to have individuals, again, continuously to remember to wash their hands, stay at least 6 feet apart from each other, avoid crowded areas, and wear a mask. A mask. How simple, yet how can something be so complicated? Mask wearing has become a topic of fierce debate not only here but across the whole country. Many different researchers are emphasizing that there are two main reasons to wear a mask. There is some evidence of protection for the wearer, okay, but stronger evidence that the mask protects others from catching an infection from that person wearing the mask. That's what's important. You are protecting somebody else. How much protection a mask provides both to the wearers and to the people around them, okay, depends on the type of mask that is being used and whether you're wearing it properly. I can't tell you how many times I see people going around with the mask over their mouth and nothing over their nose. You might as well forget it. You have to have your mouth and your nose covered or it's doing nothing. Okay, N95 masks are designed to fit tightly around the nose and the mouth so that you can let air breathe through that but not coming out from the sides of the mask. They can block at least 95% of those small airborne particles and are designed to protect both the wearer and other people. Those are the masks that are designed or to be used by medical personnel, emergency personnel, and they need to be saved for that because they are still in short supply. Before anybody complains about how uncomfortable some of their homemade masks are, try wearing one of these N95s for 12 hours a day, day after day, for the last 6 months. We get headaches from them, tight skin, breaking out, sore areas or ears, and they are hot, okay? I'd much rather wear a regular mask with it, but not when I'm exposed to somebody coming in every day. We are trying to protect ourselves as well when we get up every day to try to go into the lion's den. That's literally what we're doing every day. We're exposing ourselves or potentially exposing ourselves to everybody else. Surgical masks are designed to protect people from the wearer. Because they fit loosely, the wearer can still breathe in unfiltered air from the sides. Even so, surgical masks provide some benefit to the wearer as well. Laboratory testing has found that those surgical masks can block out 75% of those respiratory droplet-sized particles. Now when it comes to the cloth masks, the protection depends on what they're made of and how they fit. Okay, I've had some come in with a crocheted mask. Okay, that is not going to do anything. It's nothing but holes. Okay, you have to have the right material that is going to at least offer some protection. And if you wear it the way you're supposed to, that can offer anywhere up to 30 to 50% benefit or more. Now, that's far from full protection. Okay, but combined with the social distancing and the hand washing, it's certainly better than nothing. Okay, so remember that. You are still helping somebody else as well, too. And yet, people every day complain about it. They only have to wear it a fraction of the day to begin with. Okay, I hear from patients who refuse to wear them. We hear comments every day such as, they are just too uncomfortable. I'm not worried about this anyway. If I get it, I get it. Okay, the ones who tend to complain the most are many of the same individuals who later are calling us because now they are either positive or they've been around someone who has been positive and now they're demanding to know what we're going to do about it. Okay, I've lost count of the number of stories elaborated on this, and even when we think we've heard it all, every day something else tops it. We need to start looking out for ourselves and doing things on our own to help make a difference with our own health. Everybody needs to do that. You see every day someone on Facebook or Twitter or any other social media aspect ranting and raving about masks and how it infringes on their rights. You also see the opposite, where other people are trolling on others for not wearing the masks. Okay, the best ones are how the masks are all political, and it depends on whether you're a Democrat or a Republican. This virus could care less about your political affiliation. People are off spouting statistics about this or that, and they actually don't have a clue what they're even talking about, but that makes it sound good when they can put it on Facebook. People say incredibly awful things this way, and many times would not ever say that directly to somebody else, but it's okay to do it on social media. Another problem this virus has caused is a lack of kindness. Growing up, my mom always taught me to treat others the way I would want to be treated. Now, it was years later where I didn't realize that this was the golden rule. Okay, this was just mom's rule and everybody followed it. Okay, so everybody talks about bullying in school and how this has to be stopped, but so many of us are doing the same thing as an adult right now when we try to take it out on other people who either don't wear a mask or are wearing a mask, and it does not go against their own personal beliefs. Kindness is not doing something for someone else because they can't, but it's doing something for someone else because you can. Remember that. Wearing a mask shows that you actually care about the people around you. In a world full of people right now who couldn't care less, okay, be someone who couldn't care more. Wear a mask. Kindness is contagious too. Why don't we try passing this on to everybody instead of this virus? Maybe this will catch on and we'll actually have more benefit out of all of this. We are all in this together whether we want to be or not. We may know our own situations, but we have no idea what everybody else's situation is at that particular time. It may even be worse. So think about it before you take it out on somebody else. What can you do to make it better? Or is it just easier to keep complaining and taking it out on somebody else? Care about somebody else. Kindness. Let's make this become the next pandemic. And with that, I'm going to stop and I will hand it over to Cindy Mydland from Sanford.
Thank you, Dr. Dan. Fabulous comments. Thank you. In so many ways. And I do want to tag a little bit on to Dr. Dan's comments on masking. You know, kind of some of the same stuff. I'm not going to repeat all of it, but be the change. Not a lot of people are masking in this community. In Minnesota, neighboring, they mandated it from the beginning, so everybody wears a mask. And so they've kind of made it a habit. But we have that freedom here. But it seems that, I don't know if people feel uncomfortable or they don't want to be the only one, but I would encourage people to be the change. And don't worry about what it looks like. And you do get used to it. And be the role model for others. As more people mask, others will follow and feel more comfortable. And the more that you wear it, you get more comfortable with it. Some enjoy wearing a logo of their favorite team. In my house, it's Minnesota Twins. I saw a woman working at McDonald's this morning. Hers had just a big, huge smile on it. I thought it was very funny. And so there's lots of ways that you can have fun with it and express yourself. So whatever it is that works for you, please get a mask. Masking in public, anytime you're with other people within that 6 feet for a period of time, keeps our workforce healthy and in place, keeps our businesses open, keeps our schools going, and we all want that. And to do that, we all have to do our part. And we have to have masking be your norm. And if you know, it's one more thing you have to grab on your way out the door, you know, grab your phone, grab your keys, grab your mask, or have an extra one in the car so you always have one in case you get to the store and you're like, oh, shoot, I forgot my mask. It can be slightly uncomfortable at first getting used to it. Like Dr. Dan said, the N95s that they have to wear at the clinic, way more uncomfortable. So wearing it for a little while, you know, it's a small sacrifice. And we should be doing it for our community. And we'll never know the difference that we make. I think a lot of people say, well, you know, it won't do any good. Well, you won't know. Just like we don't know when we put on a seatbelt every day. Like we don't know when we put down our phone in the car a difference we made. You don't do it because you have to know ahead of time what the future would bring that you made a difference. You do it because it's the right thing to do and it's what you do for your community. So I would ask that we all work on that and help each other with that. The big piece that I wanted to talk about and very briefly is the importance of continuing with your regular routine health care. It's safe to come to the clinic. We need you to come back. We need, and we're seeing more of that. But we want it to continue. We want to encourage that. It is safe to come into the clinic. You know, our employees are screened every day, take their temperatures. That's why I have a little date and an E that I'm an employee that you got checked out each day. You know, we follow CDC guidelines. All of the healthcare partners in town follow CDC guidelines for PPE, for masking, for cleaning, sanitizing, all of those things. Social distancing is done in our waiting areas. We have plexiglass up everywhere. It's important to note that we haven't had any work-related COVID exposures of any of our employees. So I think that's a good indication that it works. Is it 100% anywhere? No. But if you continually, consistently do all the right things, it makes a difference. So we want to make sure that you keep up on your wellness visits, your vaccinations, your cancer screenings, all of those things, because your routine care and ignoring it can result in some serious health concerns. It's more important than ever to take care of your chronic conditions like diabetes, high blood pressure, COPD, whatever it is, because these conditions can make you even more vulnerable for COVID or have more severe complications if you contract it. If children fall behind on their immunizations, we run the risk of having outbreaks of preventative diseases. And please don't use COVID as an excuse for not getting that colonoscopy or that mammogram, the things that we kind of have a way of putting off anyway because we'd rather not do it. You know, cancer doesn't pay attention to COVID, just like Dr. Dan talked about. It doesn't care about politics either. So the rate of cancer doesn't change just because of COVID. And the earlier that there's any detection, obviously, the better the treatment, the better the outcome. And finally, get a flu shot. This year, it's especially important to get a flu shot, and we're trying to roll it out a little bit earlier. Sanford Health and all of our partners want to encourage you to get a flu shot because we've got 2 illnesses that we're going to be working on this fall, both COVID and influenza. And by getting vaccinated against the flu, we reduce the incidence of more people getting sick, putting more pressure on healthcare. It's just best for everyone. We want to make sure that you get your flu shot. Everyone over 6 months of age should be getting one every year, but we want to say, especially this year, get your flu shot. Getting the flu can also weaken your immune system, making you more vulnerable to COVID and its complications as well, or other infections related to that. So those are the things I wanted to touch on. I just want to say thank you for all that you're doing to protect your friends, your family, your community, and keep doing it. Thank you so much. Next up is Amanda Ulmer from HSA.
Thank you, Cindy. I'm just going to talk briefly about our mental health and how that can be impacted with our physical health and physical exercise. With all this masks wearing that we are talking about and the importance of it, we might need to get out and get moving to get some extra oxygen. Mental health is impacted by physical exercise in that it releases the actual feel-good, the neurotransmitters, serotonin, dopamine, and norepinephrine, which is the same things that like medicine can provide too. So that's why it's important to get out and get moving in a time where we are under more stress than normal. We talk about distress tolerance skill in DBT, which is dialectical behavioral therapy, and in that skill is physical exercise. So we encourage people to minimize some of that stress in our lives by getting out and getting active, whether it's yoga, running, biking, dancing. It can take on different forms, lifting weights, whatever it is, but I think that to help improve your mental health and reduce some stress, it would be good to get out and get yourself moving. And that's all that I have. Thank you.
Thank you to all of our speakers today. Are there any questions from the media?
Question for Mayor Sarah Caron. Dan Christopher from the Public Opinion. Yeah, you mentioned at the outset of this meeting that obviously Brookings passed a mask mandate earlier this week. Similar sized communities, similar number of cases, but you're hoping that Watertown doesn't have to pass a mask mandate. Can you kind of explain, well, why? I mean, also the obvious reasons, I suppose.
Well, what I want to say is we South Dakotans don't like to be told what to do, but we are kind people. We want to do what's right. I think the vast majority of people want to do the right thing, and if they think that wearing the mask is the right thing to do, I think people will do it. So I think we just want to get the message out there that it does help. It helps spread the virus, and that isn't harmful, and it's not hard to do. So if you can wear a mask, you should wear a mask.
Okay. I listened to your interview with KXLG the other day. Obviously, I think you said at one point that the demographics are a little bit different in Brookings and Watertown. Could you kind of elaborate on that?
Sure. Brookings has a similar population, but they have a college there, and they count the students in that population, and they have over 10,000 students. I don't know what the number is, compared to Watertown, which also has a college of a couple thousand students. So probably more than half of the Brookings community is college, and maybe a tenth of Watertown's community is college students. So that's a pretty big difference. The types of behaviors that people are exhibiting are different depending on where they are in their path in life. So what works in Brookings isn't necessarily what's going to work in Watertown, and vice versa. I think that Watertown is a town that cares about its citizens. The people want to be helpful and respectful of others. So I don't think we need a mask mandate. I think we just got to start doing it.
Okay. Thank you very much.
You're welcome.
All right. Thank you, everyone, for joining us today. We will be back again next Thursday and probably for a few Thursdays to come at 3 o'clock for a live community briefing. Have a great day.